This week, Muslims around the world begin observing the Islamic holy month of Ramadan, during which they fast from dawn to sunset as an act of worship. Now, for this second Ramadan to occur during the pandemic, some Islamic leaders and healthcare professionals are instructing Muslims it is religiously permitted to get vaccinated during the fasting period. Joining us to discuss Islam's holy month during the pandemic are Dr. Imran Qureshi, an interventional radiologist at Rush Copley Medical Center in Aurora. He's also the past president and current board member of the Islamic Medical Association of North America, and Aliyah Bilal, Deputy Director of the Inner City Muslim Action Network. Thanks to you both for joining us. Aliyah, let's start with you, please. For those who may not be familiar with the Islamic Holy Month, remind us about Ramadan and what it is.
Sure. Well, I think you started off well. Ramadan for Muslims across the world is a month of spiritual devotion. It's a month to kind of wrap yourselves in the remembrance of the divine, the remembrance of the Creator, the remembrance of humanity, and, through many different types of acts of devotion. So many people do that through fasting from before dawn to after, to right after sunset, through extra prayers to extra devotions during the day, extra reading of the Holy Scripture, the Quran, and through giving back to their communities. So it's a time of remembrance and a time of celebration.
And Aliyah, this is also the second Ramadan that's taking place during the pandemic. How might this one look different in 2021 than it did a year ago in 2020?
Well, I think that there are probably many institutions like ours that had some high hopes a few months ago that we might be able to go back to something that looked a little bit more like a pre-COVID era. But I think that there are probably many more institutions like ours that are deciding to play it a little more safe and just to make sure that we are emphasizing that people, keep safety at the forefront. And so while we are hosting, smaller, intimate gatherings where we're able to be a little more spaced out this month, I think there are probably going to be a lot more of the virtual events that we have been used to that we hope will still be able to connect people and engage people in profound ways.
And Dr. Qureshi, fasting, as we've discussed, is a crucial component of Ramadan, but some might be worried that getting vaccinated during this time would break the rules. Does it?
No, absolutely not. And excellent question. A lot of us had that question a few months ago, and the religious scholars seem to be pretty much unanimous consensus about saying that when you're getting the shot, it's an intramuscular shot. And it's not like you're eating anything or drinking anything or receiving IV medication. It's not considered nutritious. So the consensus opinion is that it's okay to get that shot, which is important because, as we know, some of the vaccines require 2 shots 3 weeks apart, and it will prevent people from delaying the vaccine. They won't say, oh, let's just wait 4 weeks and get it when Ramadan's over. You can get your first shot now and get the second shot in Ramadan and get vaccinated sooner, which is, our goal.
And the vaccine's dose, it's caused some reactions to some people. Should someone need to, drink water or take medicine or eat food because they are feeling sick during the holy month? Dr. Qureshi, how do you recommend somebody navigate that?
Yeah, absolutely. So the same rules would apply as if someone was conventionally sick or not able to complete their fast. You're always allowed to take medication because the goal is not to make you sick, it's to fast and complete, the fast throughout the day. So if you're feeling sick, we know that sometimes, as you said, that second dose may cause some side effects. If they're not tolerable and you don't think you can comfortably or safely complete the day, it's allowable to take the medication and break that fast, and then you can always make up that fast later.
And when you say make up that fast later, you mean fast later on, even if the month is over, just continue with them.
Exactly. Like anytime anyone is sick, I suffer from migraines. Every couple of years, I'll have a really bad migraine that I just can't make it to the evening. So you may have to break my fast and take some medication, chalk it up to just one that I need to do, and then when Ramadan's over, we have plenty of time to make up that fast.
And Aliyah, presumably, if someone were to become infected with COVID-19, they would have to break fast.
Presumably, again, it really just follows the rules of sickness. If you are sick, if you are ill while you are fasting, there's no need for you to fast. You can always make up that fast later. So absolutely, if you become infected and you can't, you need to be taking in fluids and need to be getting, medication, then absolutely you don't fast that day or the days that you need to recover.
Right. And Aliyah, also, do you encounter people who are hesitant to get vaccinated, and how do you handle that?
Yeah, it's a great question. I mean, we have been encountering as many people as we have been encountering that have been flooding us, wanting to get appointments for the vaccine. We've certainly had the number of people that have been very hesitant, very doubtful. And the reasons for that really are the same reasons that people across the country have. Communities, especially Black and Brown communities, that have historical reasons for being distrustful and doubtful of the pharmaceutical industry or of the government. People have those concerns. And so for us at Iman, part of our plight over the last several months, and we're very excited and happy that we are reaching now 1,500 vaccinations that we've been able to do in our federally qualified health center, that we help people to understand that while we are offering this vaccination, that this is so much more than just a stab in the arm, that this is about holistic health, and people need to be thinking about holistic health as they are getting themselves through this current crisis.
Okay. Best of luck to you both during this holy month. And our thanks to Aliyah Bilal and Dr. Imran Qureshi for joining us.
Thank you.
Thank you.